Carly, you work with the American Lung Association. You've heard the messages that Chris is trying to get across. Tell us your perception of all this. What do you think are the important issues for the American Lung Association to use to get the message out, to educate people in the community?
Sure. Well, you know, I think Chris does bring up a great point that prevention is not enough, and we, you know, are really committed to raising awareness of lung cancer. Putting it, I like that he used the word radar. We always say that lung cancer is just not on people's radar like some of the other diseases are. And, you know, do we want it to be, you know, something that is a big fear for everyone? No, but we want it to be on your radar. So you know the risk factors and you know how to reduce your risk factors. You know if you are high risk, and if you are high risk, you know how to get screened. You know the symptoms so that if you are experiencing a symptom, you can be persistent with your doctor and say, this isn't right. You know, I know that maybe you know, lung cancer isn't the first thing that comes to mind, but let's look into it, you know, kind of thing. We need to change the face of lung cancer. Many lung cancer patients, because of the stigma, don't feel comfortable speaking up and sharing their story. And so we have many lung cancer patients that, you know, feel isolated. They don't know another lung cancer patient. So we are very interested in connecting them to a larger community, and the Lung Association is part of that community. Connecting them to other lung cancer patients, connecting them to education and to resources so that lung cancer patients are empowered and they are really meeting their doctors halfway or more than halfway, right. That they feel empowered to go into a doctor's office and say, here's what I want out of my treatment, here's what's important to me, now tell me what are my options. All of those things are very important to the Lung Association. We have initiatives really focused on all of that.
And Chris, the world has become a very small place now with social media, with the internet, and patients are so empowered to own their disease. Don't just accept what your doctor down the road tells you, but go and get a second opinion, do your research, do your homework, get educated, get second opinions. I mean, that's hugely valuable, isn't it? That family members, patients, caregivers really can own this and change the course of their loved one's cancer journey.
Yeah, I mean, they can own it, but I think it's important to make sure that you have somebody that went from possibly knowing absolutely nothing about cancer, not just lung cancer, but absolutely nothing. And it can't be so much about them having to be so educated about their disease, so much that they can't count on their docs to be able to do it. The fact that 50% don't do the basic genetic testing, that's not about the survivor. That is not about that person. They shouldn't have to be the one that sends the message that says that's unacceptable. When we know, I mean, as I go around the country and I see survivors that are directly related to their ability to be EGFR positive or ALK positive or ROS1 positive, you can see their quality of life is completely different, right? If we make that a priority, that has to get done, that has to go across the board so that somebody, that their care is not based on their zip code. Right. I mean, we can't allow that to happen because they cannot drive far enough to get to that academic center, because they're not close enough to it, then they end up suffering because of that. You know, we have to fight to make sure that the care that you would get at the academic center is on par with what you could get, or the community center is on par with what you could get at an academic
And there's
center.
a big conflict there, isn't there, for many patients, because you want them to travel to centres of excellence to get the best possible care, but at the same time, patients have their own lives to live, and when they're having treatment where they're having to go very regularly, sometimes even daily, and it becomes a big issue, not just for the burden of going, but the cost of going. You know, there's a big financial issue with cancer care.
It's a huge issue. So I would say ideally for us is we don't want them to have to travel. Ideally that they could get the care that they need at home. Because if they don't have to travel, that means they're spending more time with their spouse, with their kids, with their extended family, with their friends. I mean, they're already going through something that is serious and is difficult. But to have to then go someplace else, if you don't have to travel, you might be able to maintain your job. You know, maybe they can make some adjustments, but you can still continue to work. And if you continue to work, I mean, that's a big deal.
I mean, and in the profession, we know where these centres of excellence are. We know that there are specialists who are in academic centres, very involved in research, pushing the boundaries of cancer care. But patients don't always know whether they're with a good doctor who's right at the forefront of the medical field, or whether this is a community oncologist who may not have been to any academic meeting or kept up to date. How do we educate patients to get to the right people?
Well, and again, that message is being shared around as where we're highlighting different docs, and the idea of academic centers, you're seeing that more. But I think it's not just about the patient getting to them, because that could mean that they've got to travel. There's some internal housekeeping that we have to do, and that is making sure that the information that is at that academic center is getting to those local medical oncologists.